Well, I decided to do TMS because I heard Dr. Nanos describing it and I got really interested. I've had many traumas over my life and had a lot of brain injuries or concussions, and it's developed memory loss. And I've had all this trauma that I'm learning that I've suppressed. But anyway, looking into it, I thought it could really help me out. It definitely didn't look like it could hurt me in any way, so I felt to go forward with the TMS. Okay, so the application of the TMS felt like tapping or pulse on your head. There was some slight twitching in my eye and in my mouth, but it wasn't painful at all. It only lasted like a couple of minutes each time we did it. The intensity could be increased or decreased. The person monitoring or applying the pulses would check in every time. Is that too high? Is that too, you want to go higher or lower? So made it very comfortable. Was able to talk about it. The health coaching was good. It was very busy, so I didn't spend a lot of time with the individuals till more at the end of the week.
Mm-hmm.
But it was there. It was all good. It was supportive of the whole process, and there was a lot to learn. I didn't know what to expect to begin with, but as the week went on, it became pretty clear and relaxing. And now that it's been a couple of weeks out, I did notice immediately within 2 or 3 or 4 days that it seemed like I was able to focus better, just casually watching TV, which normally I never can concentrate on. But I was able to focus on that. I think my daily tasks, I can focus better. So many memories that I feel like I had suppressed, I was able to remember and process without being emotional, or it was just able to think about it and deal with it without any real problems or no problems at all. I also have epilepsy, and there's been some concern about all the different medications that I've had over the last few years, even concern of the medications I had as a child. And so, talking to Dr. Nanos, we were trying to determine what, if any, of these medications need to continue. And so, I was able to meet with my neurologist a couple of days ago, and we immediately started to decrease the medication pretty significantly. And within a month, we're going to eliminate one medication altogether. And I'm really excited to take less meds and maybe someday not take any meds. Everything has been very positive in that respect. What I'm looking forward to in the future is just being able to deal with the life experiences without feeling depressed or anxious, or just being able to remember things the way they happened and not have them tied to trauma that I feel like I don't want to remember. I'd rather just be able to remember them the way they occurred and process them effectively. After doing the TMS, I have already recommended to two of my children to get involved with the TMS. They too have had their own experiences that I'm sure this would help. And they're very excited about it. They've also researched the internet after I described the process and what it's intended for. And we're going to begin treatment with one of my children very soon, and the other as soon as they have a break in about 6 months.